Hello, everyone. My name is Cheng Wong. My English name is Vienna. I'm currently a doctoral student studying the PhD in the public policy at Macao Polytechnic University. Today, I'm going to share my conference paper on the topic of exploring the efficacy of cognitive behavioral therapy for treatment of pathological gambling. This study aims to examine the effectiveness of cognitive behavioral therapy as the treatment of pathological gambling among problem gamblers. The research question in my research was, does cognitive behavioral therapy acts as an effective psychosocial intervention for treatment of pathological gambling among problem gamblers in the long term? Pathological gambling refers to the repeat gambling in an impulsive way, which cause numerous negative impacts on a person's mental health, occupation, and relationship with significant others. According to the DSM-IV criteria, if a person presents with repeat gambling behaviors with 5 or more clinical symptoms, within a month, he or she will be diagnosed as a pathological gambler. Some of the symptoms of the pathological gambling include preoccupied with gambling desires or urge all the time, a desire to gamble with increasing amount of money in order to reach desirable excitement, feeling depressed or anxious once gambling behaviors stop, use gambling as a way to escape from reality, tell lies to family members or friends in order to hide one's severity of gambling symptoms, commit serious crimes such as theft, fraud, or forgery, depends on others to help resolve a financial crisis or situation due to excessive gambling behaviors. The DSM-IV criteria describe pathological gambling as a type of impulsive control disorder. After the DSM-V criteria established, pathological gambling had shifted to a new classification system and classified as one of the substance misuse disorder and addictive disorders. Cognitive behavioral therapy is a structured and goal-oriented intervention which aims to focus on reducing various symptoms of anxiety and depression among people suffering from mental disorders. It helps people to identify and change their thinking and behavioral patterns that are harmful or ineffective by replacing them with accurate thoughts and functional behaviors. For pathological gamblers, CBT also helps to minimize their excessive gambling behaviors by teaching them useful skills and techniques that incorporate both behavioral and cognitive elements. And my research is a systematic review collecting a list of quantitative studies and exploring the effectiveness of cognitive behavioral therapy for adult problem gamblers. Journal articles and papers were selected using 4 databases, including PubMed, PsycInfo, Countering Central Register of Controlled Trials, and BASE. The specific inclusion and exclusion criteria for this review was based on the PICO's framework. This review includes adults with diagnosis of pathological gambling, outpatient and inpatient groups, community volunteers, different forms of cognitive behavioral therapy, any comparative studies, papers that report any of the outcomes such as frequency of gambling, amount of money lost by gambling, gambling severity, and psychological distress. All types of quantitative studies, including randomized controlled trials. It excludes individuals under 18 years old, individuals diagnosed with comorbid mental disorder, individuals with suicidal thoughts and behaviors. Exclude cognitive behavioral therapy combined with other forms of therapy. exclude studies without any comparison group, papers that do not report frequency of gambling, amount of money spent in gambling, gambling severity, and psychological distress, exclude qualitative studies and case studies. For the data extraction, all the papers were extracted based on 3 stages. At the first stage, only the titles and abstracts of the relevant papers were extracted. And at the second stage, the whole text from all the relevant papers were screened for selection. Only the papers that relate to the inclusion criteria were selected at the end of the screening process. After data extraction, all the data were grouped together in the form of a table for narrative synthesis. All the studies were presented with information on participants, intervention, outcomes, study design, comparators, and key findings. For the quality assessment, this review assessed journal articles and select studies using quantitative method. Selection bias, binding effect in intervention integrity, and rate of withdrawal among the selected study were assessed using the Effective Public Health Practice Project for quantitative studies. There were a total of 5,001,975 potential studies identified from the search of the database. A total of 7 such studies were selected at the end of the search process for this review. A sample of 688 participants took part in this study between the age of 18 years old and 78 years old. For the study outcomes, most studies, 5 out of 7 studies, demonstrate significant reduction in gambling frequency among participants after receiving cognitive behavioral therapy compared to treatment as usual or control groups. 5 studies found significant reduction in the gambling frequency, also found significant reduction in the severity of gambling symptoms among participants. In terms of the amount of money spent in gambling, only 2 studies found significant reduction in the amount of money gambled among participants receiving CBT. 2 studies found significant decrease in the levels of psychological distress among participants receiving cognitive behavioral therapy. In the conclusion of results, most research provide evidence that CBT is effective at reducing both gambling frequency and severity of the gambling symptoms among participants suffering with pathological gambling. However, this review found that CBT only demonstrates a moderate treatment effect for reduction in the amount of money gambled and the levels of psychological distress among participants. One of the strengths of this review is the recruitment of participants from different cultural backgrounds, including participants from a wide range of backgrounds, and hence the overall generalizability of the research findings, which the result can represent to the wider population across different cultural groups. The focus on specific target population in the inclusion and exclusion criteria is also another strength. This makes it easier to look into appropriate studies and outcomes that relate and associate with the aim and purpose of the research. Selecting quantitative studies leads to highly significant results for the treatment efficacy because the study outcome usually conclude cause and effect relationships. The random assignment of participants in randomized control trials ensures that the treatment effects of the selected studies were less likely to be influenced by selection bias or other confounded variables. One issue of this review is the lack of statistical significance in some of the selected studies. 3 studies with small sample sizes found non-significant difference in both the amount of money gambled and psychological distress among participants receiving CBT. Cultural perception is another factor that needs to be considered as a result of lack of statistical significance. For some cultures with highly permissive beliefs, problem gamblers may be less likely to seek help through psychosocial intervention. As a result, some studies demonstrate high levels of dropouts among participants. This review includes different forms of CBT, which makes the selected studies more appropriate with the research aim and the purpose of the review. However, it only selected a sufficient number of relevant studies based on the specific selection criteria. A large number of irrelevant studies were excluded after scanning the title. This means that the search terms that used in the database search may not be precise enough for the inclusion of a large number of relevant studies. Therefore, in future research, it's necessary to recruit larger sample size to enhance the statistical power of research findings. There is also a need to include some gray literature during the search process so as to increase the number of selected papers that fit into the aim of the research. For the pathological gambler with...
Go to the end because 10 minutes passed.
For pathological gamblers with a large number of symptoms, CBT alone is not sufficient. Motivational interviewing, psychoeducation, and group therapy and medication are also believed to be effective in the treatment of pathological gambling when combined with CBT. Future research with multimodal approach is necessary to investigate the outcomes of gambling symptoms among patients diagnosed with severe gambling problems. And nowadays, this approach is also becoming the most effective intervention used for the treatment of problem gambling in the Chinese culture. And this is the end of my presentation.
Okay.
Thank you for